for setting up this webinar. In fact, Happy New Year to all of you. I am Dr. Nandini Gokulchandran. I know it's a difficult name to remember. Just remember me as Dr. Nandini. I am from India, and I am happy to be a part of this webinar for the West Europe. Neurogen in collaboration with Christina's organization. Christina has done a lot of work in putting some Slavic subtitles to the presentation. Thank you so much, Christina. And I hope this helps you in understanding the concept of recent advances, newer treatments that can be done for incurable neurological conditions. So this is an attempt, as she said, the first time that a webinar is being conducted to bring together the technologies between India and Slovenia, and I'm happy to be here today. So we are going to talk a lot about neurological disability, inability of an individual to do various activities, either due to physical impairment or which could become more because of environmental impairment and social. So when you are unable to walk or you are in a wheelchair and there is no wheelchair access, then at that time, that particular impairment, physical impairment, becomes a disability because you can't go to a hospital or you can't go to a mall, and that becomes, the problem becomes more severe. There are different types of disabilities. One could be because of physical issues and one could be because of cognitive issues or understanding, lack of understanding. But the burden increases because of poverty, lack of awareness. The people don't know that there are treatment options where the physical issues or cognitive issues can be treated. And also because there is no awareness, no treatment is done. And because no treatment is done, there is no improvement in an individual, leading to no contribution to the community or to the family, and burden on the family increases, and thereby disability becomes dependence. So there are a lot of individuals, there are a lot of people in the world who may have a disability but are independent or are contributing to the society in a constructive way. However, if there is no treatment or if there is no contribution, then disability that becomes a dependence. So now we will look at what are the neurological disorders which can be treated with newer treatments which are available, and I'm going to talk about those treatments today. As Christina enumerated, autism, cerebral palsy, muscular dystrophy, ataxia, spinal cord injury, intellectual disability or mental retardation, brain stroke. So these are disorders which till very recently were considered to be incurable. Not only incurable, when you would go to a doctor or a neurologist, you would be told there is no treatment, nothing can be done. And that's where now science and regenerative medicine has proven a lot of old conceptions and misconceptions to be wrong, and that we have seen, and it has been seen that neurological conditions can be treated and brain can repair and regenerate. So why are we all here? I'm sure there are some clinicians, some doctors, some parents, some caretakers of individuals with various neurological conditions, and we are here to understand what are our options, what all can we do. So the current paradigm, so far for neurological disorders, what are the current treatment options? Number one, what is understood is there is no cure. Number two, there are no surgical interventions. There is only exercise or rehabilitation. And there are no medicines to cure these conditions. That's what we understand currently. So now this is an example to show you that these are scans known as PET scan of the brain, which shows all these blue areas show damage. These are the areas which are working less. And what we are going to see today is that this damage is correctable. It can be treated. So what are the treatment options that we have? We have on one side rehabilitation that you all know of, occupational therapy, physiotherapy, speech therapy, applied behavioral analysis, sensory integration, aquatic therapy, art-based therapy, all these therapies for various neurological conditions. In addition, now we have cellular therapies. Cellular therapy along with rehabilitation gives beautiful results. And now in addition, there are more recent advances which when worked together, these are known as integrated therapies, which are examples are ozone therapy and hyperbaric oxygen therapy and whole body cryotherapy. All these together, along with cellular therapy, helps to improve the outcome of any treatment. So what kind of changes can we expect to see, and what are the information that you can expect to hear today in this webinar? So this is a brain scan, which is PET scan, which is taken before the treatment, and as I showed you, the blue areas here you can see indicate that these areas are working less or are damaged. Now 6 months after the treatment, what can you see? The blue areas are now green. Green indicates good functioning brain, a normal brain. So the blue areas have become green. That means the damaged areas have now become active. And now that they have become active, all the rehabilitation procedures now become more effective. What does that mean? That physiotherapy, occupational therapy, speech therapy, all these things after the stem cell therapy become very, very effective. Now, let us take an example. You must be thinking, I'm talking about the brain, and now why suddenly I'm showing you a picture of a fracture of a bone? I'm sure you understand that this is a fracture of a leg bone. You can see that if we have a fracture, I think everybody in this webinar either would have had a fracture at some point in your life or would have had a friend or a relative who had a fracture at some point. Now, what is the treatment for fracture? Do you start exercise immediately? No. What do? We fix the fracture, right? We either put a plaster of Paris, or we do surgery to make the bone stronger. And once this is done, only then you start your exercise to strengthen the muscles again, isn't it? So why not in case of brain? Why do we not think similarly for brain? So here you have a brain which is functioning less. You can see these blue areas are functioning less, okay? And here what we have done, we have repaired the brain. We have improved the brain functioning. And now when you do the physiotherapy or occupational therapy and the speech therapy, now you will find that the results are better. So that's the analogy or comparison. Okay, now let us go again to what was thought previously and why it took so long for people to catch up that there is a possibility of brain functioning or of treating neurological conditions. The old thought process was that once central nervous system is damaged, it is incapable of regeneration or repair. That was the old thought process. But the new thinking, after a lot of research, is that it is possible to regenerate the brain. It is possible to repair the brain with cellular therapy. Why? Because brain continues to have certain pockets which multiply lifelong. Now imagine that if the brain would not be multiplying, what would have happened? You would not have been able to create new memories, right? You would, if you would come to India, you would not, when you go back, you would not remember what all you did in India, because the brain is incapable of creating new memories. But that happens only in dementia, right? But otherwise, you and me, we keep forming new memories, and that means that new multiplication of new cells is happening. New connections are being formed. Okay, that's why the thought process has changed. The old thought has gone away and new thoughts have been created, or new thinking or new perception, new understanding has now come that it is possible to improve brain functioning or repair the damaged brain using cellular therapy. So what is cell therapy? Cell therapy is an idea whose time has come. It is not a fiction. It is not a science fiction. It is a treatment of today. And this we are going to see and experience. Okay, so cellular therapy has the potential to help a child who is on wheelchair to stand and walk. So what is cell therapy or what is stem cell therapy? So it's like this sapling. Okay, this is a small plant. Okay, the small plant with a very thin stem. Okay, and now when we pour water, we give fertilizer, this sapling or this small plant will grow. It will give rise to leaves. It will give rise to flowers. It will give rise to fruits. And that's what a stem cell is capable of doing. So here you have a stem, okay, in English, stem of a tree. So stem of a tree similar to stem cells. So stem of a tree, when you give water, when you give fertilizer, it gives rise to branches and it gives rise to leaves, flowers and fruits. Similarly, stem cells are special cells in our body which have the ability to multiply. It can become many, many cells like their own, and then depending on which part you put it, if you put them in the liver, they can become liver-like cells. If you put them in the heart, they can help heart become better. If you put them in the brain, you can help improve brain functioning. There are different types of stem cells and different ways that we can put it in our body. If we take from our own body and put it in a different part of the body, of the same body, my own body, then it's called autologous. And if you take from somewhere else and put it in another part, it is known as allogenic. Let us see how this works. Stem cells have special capability to multiply. So one cell can become many, 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 many cells. So one can become about 1,000 cells and more. Then they can become different types of cells. They multiply and they can differentiate. So for example, when a child goes to a school, the child has a potential to become an engineer, a doctor, a teacher, a lawyer, a physiotherapist, occupational therapist, but doesn't know the potential. But it depends on, how much he studies, how is the environment at home, what kind of inspiration he gets from the teachers, right? Similarly, these stem cells have potential to become any type of cell in their body, and they can therefore become a liver cell or a heart cell or a nerve cell. So it depends on where their path leads them. So they can convert into any type of cell of our body. And this is an example of nerve cells, nerve-like cells which connect with each other, which have been derived from this stem cell here. What do then? They release a lot of positive chemicals to help repair a certain part. For example, we know that if we get hurt, if your skin gets wounded, okay, you fall down and you get scraped, what happens? The wound heals by itself. Okay, how does that happen? Because once there is a scraping, there is blood flow which happens in your skin, and there a lot of growth factors are released, and this will help to repair that wound. So that is a repair capacity of the body, and stem cells have that potential to release these positive chemicals to induce repair process. Improves blood supply. So as blood supply increases, oxygenation increases, newer positive chemicals are reached to that part. Now we're talking about the brain. So we are thinking of putting the cells near the brain and thereby improving the brain functioning. So what are the major types of stem cells? As Christina mentioned, there is a lot of misconception and misunderstanding about stem cells, and there are these blanket generalized statements which are being made saying that they are banned, or they are, that there are side effects and long-term issues and tumor formation. So it is important for parents as well as professionals to understand the distinction, the differentiation between different types of stem cells. So we are all born from stem cells. Okay, when we were in our mother's womb, we were all one cell stage, right? Like this. Okay, this one cell stage then divided into a bunch of cells and known as blastocyst, and this is an embryo of about 3 to 4 days, and when this is then used or in the laboratory to form different types of cells, that's where they are known as embryonic stem cells. Okay, so how do we get these cells? You must have heard of test tube babies, and you must be in your country having different fertility experts, and where parents or the couples go, those who don't have children or who cannot conceive normally, so they go and they the male gives the sperm and the female gives the egg, and then they are fertilized outside in a test tube known as test tube baby. 12 to 13 embryos are fertilized. Out of that, 3 to 4 are put in the mother's womb, and about 7 to 8 go waste, right? These waste embryos become a source of stem cells which can be cultivated in the laboratory, and these cells can form any type of tissue in our body. They have a lot of potential. However, there are certain issues with them. One is an ethical issue. There are religions which where the thought is that once the life starts, even at a one cell stage, that particular egg has life, and if you are using these embryos for the for clinical purpose or even for research, that means you are killing an embryo, and hence for ethical reasons or human rights reason, these cells cannot be used for even for research or for treatment. The second issue is that these cells have the potential to form tumors known as teratomas, that is their characteristics. Okay, so because of these two reasons, the use of embryonic stem cell for treatment of a clinical transplantation is suggested to be avoided. So if anybody talks about banning or if anybody talks about tumorigenicity, it is connected to embryonic stem cells and not to adult stem cells. And because this happened in United States of America, the other parts of the world started looking at other forms of stem cells like fetal stem cells, or started looking at cord blood stem cells, started looking at adult stem cells. So what is cord blood stem cells? By now everybody knows that when a child is born, the child and mother are connected by an umbilical cord, and this umbilical cord with the placenta has a lot of cells which belong to the child and have potential similar to a stem cell. Now these are very good source for blood disorders. Here we are talking about neurological disorders, and thereby the adult stem cells become a very positive or a feasible option, because adult stem cells can be taken from the patient's own body, from the bone marrow, from the fat tissue, from even dental cells. And bone marrow has been studied for a long time, and lot of awards and lot of Nobel Prize has been awarded for the discovery of stem cells in the bone marrow, and they are from the patient's own body. No embryo has been killed, and that's why, and it is a safe possibility, no tumorigenicity, and hence it becomes a possible option for clinical use, for clinical transplantation. The fourth type of stem cell that has come to light in 2012 is an induced pluripotent stem cell. Now, induced pluripotent stem cell are designer stem cells where from skin cells, for example, skin cells can be reprogrammed to become embryonic like stem cells. So these are known as designer stem cell. A lot of research is still happening. So out of all of these, adult stem cells taken from bone marrow become one of the most feasible, simple option for clinical use. So why am I showing this? I think because it's lunchtime in India, or it's breakfast time back there in Slovenia. No, this is because I'm talking about putting together everything, and basically not clubbing all type of stem cells together. So this year is, I'm sure you'll have enjoyed this during Christmas and over the New Year. So this is alcohol, and this is of course homemade orange juice, right? So alcohol, we know, although it may have an immediate positive effect, there is a long-term issues of liver toxicity, while homemade orange juice made by mother with a lot of love, fresh from the right from the orange, doesn't have any side effect, cannot do anything wrong for the child or for the individual, and has a lot of nutrition, right? So Alcohol is like embryonic stem cell, while homemade orange juice is like adult stem cells. So if we put all together, then there's a lot of confusion. And I hope I have been able to clarify that. So at Neurogen Brain and Spine Institute, which has been functional for the last 12 years, we have been working on adult stem cells from the bone marrow because they are safe, non-tumorogenic, no rejection issues, easily obtainable with a very thin needle, which we will be showing you. No ethical issues because we are not killing any embryo. We are taking bone marrow, which will form again within a few days, which we call as replenishable. So there are different ways that stem cells can be injected. So it can be injected intravenously, IV, into the veins. It can be given through the nose. It can be given into the muscles. It can be given into the artery. It can be given directly into the brain, or it can be given into the spinal fluid. Each of these different routes of administration have their pros and cons, and after understanding and weighing all of that, we use the intrathecal transplantation. What does that mean? We inject the cells into the back here, into the spinal fluid, and with the fluid the cells reach either wherever the damage is. If it's in the spinal cord, then damage in cells will reach the spinal cord. If it's in the problem is in the brain, the cells will reach the brain and help start the repair process. Well, then this process becomes minimally invasive. It's one needle in the back. It is safe. There are no major side effects. We are not injuring the brain. It doesn't get diluted in the liver, or it doesn't go anywhere else except the brain and spine. And the cells will reach the damaged tissue only, and thereby making the treatment more effective. So this is a brain PET scan which shows damage here, and cells will reach the damaged area and stimulate the brain to function better and help improve the functioning. You can see that the dark blue parts have reduced and the brain is more active. So what is the scientific basis for cell therapy? Is it something which has come yesterday, or what is known about it? So as I said, Nobel Prize have been awarded for research in cellular therapy, or in stem cells, basically, about what are the different types of stem cells, what are the characteristics. Way back in 1990, Professor Thomas received a Nobel Prize for demonstration of stem cells in bone marrow. In 2007, Sir Martin Evans received the award, Nobel Prize for isolation of embryonic stem cells in the mice. And recently in 2012, two scientists, one from the US, one from Japan, Professor Gurdon and Professor Shinya Yamanaka, received the Nobel Prize for the concept of induced pluripotent stem cells. So the understanding about stem cell research is almost 30 to 40, 50 years old, and we can see that the first ever Nobel Prize was awarded to bone marrow, stem cells in the bone marrow. So a lot is understood about stem cells. It's characterized very much in detail, and of course newer things keep getting added every day. At Neurogen, what is the scientific basis? Neurogen is very research focused, and whatever we do, everything, there is a scientific reason for everything that we are doing. So whatever we do, whatever we have done so far, everything is published. It is everything is published, and we have about 101 publications on the various areas that we are working on, various neurological disorders. We have 16 publications in autism, 15 in cerebral palsy, 18 in muscular dystrophy, 9 in spinal cord injury, 6 in brain stroke, and intellectual disability, amyotrophic lateral sclerosis, and various other dementia and Rett syndrome, and in ataxia, a lot of case reports and a lot of studies as well. In addition, a lot of work is in writing books and writing chapters for international books. So we've written a chapter for a book known as Recent Advances in Autism, where we're invited to write a chapter, stem cell therapy in autism spectrum disorders. Then we have been invited to write a book chapter about stem cell therapy in cerebral palsy, challenges for the future. This was a book, an in-tech book, where we wrote a chapter on stem cell therapy for cerebral palsy, a book on physical disability. Again, book had a chapter on stem cell therapy in pediatric neurological disabilities. Muscular dystrophy, again, we have written a chapter on stem cell in muscular dystrophy. Even the government of India, the highest ever prime minister, has a major support. He's instrumental in bringing the technology of induced pluripotent stem cell and starting a lab to work on it. This is our director, Professor Alok Sharma, basically giving a book that we have written on stem cell therapy neurological disorder to our Prime Minister, Mr. Narendra Modi. This is the ex-president of America talking about stem cells in his first ever presidential speech, where he lifted the ban on embryonic stem cell research in the US after about 10 years.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
This is our Prime Minister who wrote a preface for one of the books that we wrote on muscular dystrophy. So how is the treatment done? Is it a very complicated process? Parents are generally very scared because children are small and, will they be able to bear this particular treatment? There are in fact a few patients from West Europe who have come to India and they have shared their experience. But just to brief you, it's a very simple process. It's not a complicated process at all. Just one needle in the hip bone. The hip bone is right here in the front, not in the back. You can see a thin needle goes into the hip bone, and the bone marrow, which is like thick blood, is aspirated out. So it's just one needle. There are no cut, there are no stitches, there is no surgery, nothing will be visible. Then the bone marrow is processed in the laboratory, which is just next to the operation theater, and it undergoes a process known as gradient separation. So this is a tube where the bone marrow is put and it is spun in the centrifuge, and you can see the red part down. We do not need these cells. What we need here is the transparent part. So this cell is then purified and aspirated and then injected into the spinal fluid. Okay, so again one needle. So 10 minutes of aspiration, 10 minutes of injection. In between there would be a 5 to 6 hour gap where the processing is happening. So this is a process. Again, bone marrow, you can see, is being aspirated, and then in the centrifuge, bone marrow cells are being counted, and then using a very thin needle injected into the spinal fluid. So it's a very, very simple process. Bone marrow aspirated, processing. You can see now this is a product. The millions and billions of cells here, which is like a cotton ball here, and then injected into the spinal fluid. So now let's come to the topic of your interest. How does this work in various disorders? And I hope, I know it's a longish presentation, but because I had to talk about stem cells separately, then I have to talk about different disorders. I would request your patience, because I want to go a little bit about what is the problem in the brain as well. So this is cerebral palsy. You know what happens in cerebral palsy. There is damage in the brain, and there can be various disabilities, physical as well as cognitive. The problem could arise because of problem during pregnancy or during labor or immediately after birth. So a child can have, or individual can have only one hand paralysis, or can have one side paralysis, or can have lower limb paralysis, or whole body can be paralyzed. So there are different types based on that. Can be spastic cerebral palsy or dyskinetic or ataxic, based on the symptoms. So this is a PET scan and you can see the damage. The black part indicates completely dead cells. So dead cells cannot be revived. Okay, whatever, nothing, even God cannot come and revive the dead cells. But the blue areas here, you can see these can be improved. And if we are able to improve even 15 to 20% of a brain, we can get so much response in terms of improvement clinically as well. So children with cerebral palsy can have crooked legs, they can have a big head, or they can have breathing problem, or they can have inability to control the neck, or they can have tightness leading to severe spasticity or scissoring. And what is the treatment for all these medicines for the tightness, or you can have medicine for epilepsy, then you can have orthotics or splints or calipers, or you can have surgery. Okay, the surgery could be to release the deformities, rehabilitation exercise, and injections such as Botox. But with stem cells, what can we achieve? So stem cell with a good exercise, good rehabilitation program, all of this together, what can it achieve? So it can achieve almost 90% success rate, over 90% a possibility of improvement, with 30% showing mild improvement, 41% showing moderate, and more than 20% showing significant. This is an ongoing process. So first, but look at what are we actually treating. So this is a MRI of the brain, which is normal, and you can see this is a normal brain. This is mildly affected. You can see the ventricles here, the cortex or the brain matter is not very thin, slightly thin, and here very thin brain matter, very severe. Okay, so there is what is known as periventricular white matter. So these are different MRIs of the brain, various parts of the brain are affected. Even you can see here, this is a normal connections of the brain. Here the connection is thinned out. This is known as corpus callosum. So different parts of the brain can be injured based on that. Let's see the PET scan. Okay, so this is the basal ganglia, which is affected. When basal ganglia is affected, you get a movement kind of a problem known as chorioathetoid or a dyskinetic cerebral palsy. Thalamus is affected, then you have the motor problems along with spasticity. If cerebellum is affected, this small part of the brain is affected, then it causes ataxic cerebral palsy. Okay, so motor cortex and whole body is paralyzed. Sorry. So this is data which is unpublished. However, we have put together data of 262 patients in much more detail. Okay, what can we find? What do we find here? Sorry. 175 males, 83 females. What do we find here? That first of all, what do we see? We see an improvement from top to down. We see improvement in understanding and cognition. Okay, then we see improvement in the vision as well as the fixation or focusing. The next that we see is tongue movement, lip movement, speech, neck holding, okay, sitting balance, standing, and then walking. So this is a kind of improvement that we see. Tightness reduces, okay, and movement becomes much more effective. So with stem cell, as the brain improves, the activity that you are doing also becomes much better. Okay, improvement in the scores. So there are clinical scores, there are assessment which is done, GMFM, GFFCS, and FIM. That is a functional improvement measure. So all these scores also improvement. So you see progressive improvement in the child over a period of 6 months to 1 year. So these are the different books and publications, and you see the PET scan. So this is before the treatment. You can see the blue areas, they are damaged or functioning less, and you can see the black area are completely dead. So here, this is before the treatment. This is 6 months later. You can see that the blue parts have become green. and the black are still there. So the blue have become green means brain has become more active. There is a repair which has happened, and now the brain functioning will improve. These are other examples. You can see here in the midline that there's damage. After treatment, you can see that it is improved in functioning. Here you can see the thalamus here, okay, which is after the treatment you can see is active. The cerebellum is active. You can see here the blue areas have become green. Again, you can see the frontal area, a lot of damage. Now see, this improved. So as the brain becomes more active, brain becomes stronger, then all the therapy which is done, it becomes more effective. Even the therapists see better results. They see the child is responding better. The body, the brain is giving proper signal to the different parts of the body. The blue areas you can see becoming green. So the brain is now becoming more active. Now, what do we see? What kind of improvements do you see? Now, this is a child who had difficulty in walking and difficulty in even in kneeling and walking before the treatment, and after treatment, better able to kneel, better able to get up, better able to walk. This happened in about 6 months. Understanding improved, hand strength improved, ability to climb. So all activities, because the tightness became lesser, and the child was able to control the body better, and thereby all the activities, even climbing stairs, has become easier. So this is a small child who came to us at the age of 2. Earlier, he had no neck control. He could not sit. He could not focus his vision because problem was from the brain. Then he started sitting up on his own. His neck control and sitting balance became better. Then he started looking at he could recognize his father. Otherwise he would be like a child. You can see sitting has become much better, more independent. So slowly these things improve. Even with exercise, it is possible to improve. Only with stem cell, things happen faster. You can see that he's standing, and now once your neck control and sitting becomes better, then walking is much better achieved. You can see he started walking. This another child came from Nigeria to us because of jaundice, had severe brain damage leading to chorioathetoid cerebral palsy, where he had no control to the body all the time. He was moving, but with stem cell, sitting improved. You can see that the therapist is so overjoyed that after stem cell, he is able to sit. Earlier, he had no control. He would just, flop down if he was made to sit. He could not even turn. Now you can see with no support, he is able to get up. So this happened within a month of the stem cell treatment. Then before, as I said, he would just topple down. He had no body control at all. With after stem cell treatment, he was able to maintain his body much better. You'll see also that his understanding cognition improved. He's able to sit more stably. He's able to use his hands to do some daily activities like simulation of various activities. Grip improved, and you can see he's trying to have a bath. This is a child with severe injury to the brain. So at the age of 3 years, she was normal till 3, and then had severe brain damage because of an accident. And you can see that she had severe, not only severe, a lot of fits also, and vision also was not proper. So with stem cell treatment, her body posture became, her neck control became better. We were able to control her seizure with medicine. Brain started improving, sitting, neck holding, ability to control her trunk, ability to speak, even her vision or movement of the eyes improved. Vocalization started, response to name calling, visual tracking improved. This is a dystonic cerebral palsy child, very severe, very tight. When he came to us, he He had barely any control at all. You can see that, and he was not interested in doing therapy with stem cell. His body control improved, his focus improved. It took time. It took at least 2 years for him to achieve a status where he was able to, sit erect. His hand function improved. He had very, very severe brain damage. Then sitting and standing. So as neck control improved, trunk control improved, he was able to, get up. And then you can see that he started, taking steps with support, that you can see our therapist training him. So as you train, the body starts remembering things or learning things which the brain had never done before. It was a totally bedridden child. This is another patient from Kenya who came to us at the age of 14 years. He was wheelchair bound completely. His cognition was good. As he was completely wheelchair, his vision was also affected. We started training him. He started learning how to wear clothes and, pack his bag and pick up his bag, use his hand, go out at home, take out, do daily activities. Nothing was possible earlier because the muscles were very, very tight. With stem cell and good exercise, the spasticity reduced, and now he is able to, you can see, walk independently. This was absolutely not possible earlier. So these are a few examples of cerebral palsy, different ages. Now I'll be going to autism. And autism, as you know, is self-involvement. This is again a neurodevelopmental problem, occurs majorly in males, more in males than in females. The reason is not really known, maybe hormonal. And main issue is poor social interaction, communication issue, as well as restricted behavior. And the numbers is increasing. This is the number from CDC Atlanta, where it is shown that earlier it was 1 in 150 in 2000, and within 2 decades it has gone up to 1 in 59. That means in every classroom of 60 there is expected to be one child with autism, which is a huge number. So almost 70 million people in the world are on the spectrum as per the statistics. So 1% of the world's population. So, what are the new things that we know now, and how do we look at autism differently? Earlier, it was thought that autism is a psychiatric disorder. Now we know it is a neurodevelopmental disorder. Earlier, there was no scans which could really understand what is a problem, that the brain could be affected. Earlier, it was thought that the problem is because of this psychiatric issue or there is emotional disturbances. But now we know the problem has occurred because either before birth or during birth or immediately after birth, there has been an incident which has led to maybe a lack of oxygen to the brain or a lack of blood circulation to the brain, which could push the child towards autism. Earlier, it was thought that autism is a static disorder. Once it happens, it remains as it is. However, now with imaging studies, even our own study done at Neurogen, we now have seen that with age also the brain worsens. I will show you a graph which depicts that. So it's not that autism, once it happens, it remains the same. It does worsen with age, especially in the teenage. Earlier, it was thought that there was no structural issue, but we do know the volume of the brain as well as the connections in the brain are affected. So, what is wrong? Patients, and why my child? What happened? What could be the reason? So, there are multiple things. It is a multifactorial condition. That could be environmental factors, there could be genetic, and there would be a mix of both. So environmental factors could be prenatal issues, the mother's body is weak or hemoglobin is less, or mother is depressed or is diabetic or was taking medications or antidepressants. There could be problem in the intestinal function. There could be toxic chemicals which the child is exposed to when the child is in the mother's womb, or even exposure to phone. It is still a controversial topic. However, electromagnetic rays through the phone could also affect brain development is being studied. As I said, prenatal causes, all these infections, as well as smoking in the mother, alcohol when the child is in the mother's womb, age of the father, if the father is above 40 or 45 or less than 24 years, there's a possibility that the child could develop neurodevelopmental problem, one of which is autism. abnormal bacteria or abnormal growth, gut issues could also stimulate or trigger the problems in autism. Exposure to electromagnetic field, especially when the child is in the mother's room and mother is using the phone too much or keeps the phone on the womb and the tummy, and so these radiations could affect brain development. Poisoning due to lead, poisoning due to mercury, these early on when the brain is being developed. Now vaccines, there is a lot of controversy about vaccines. However, as a doctor, as a clinician, and especially coming from a developing country, we do feel that vaccines should be given to a child, especially those which are very important and which could lead to the child having infectious diseases. Though early on, it was in 1990, it was there was a study which said that vaccine, and especially the preservative in the vaccine, could be a cause of autism. However, about 25 studies this basically showed that it is not true. Now, what happens? Now, what could be the reason is one thing. What really happens in the brain of a child with autism? And this is the study that we did, where we did PET CT scan of the brain. Now, PET CT scan is an advanced technology which is generally used for cancer, where cancerous cells can be seen in different parts of the body as hypermetabolic. That is, they function too much, more than a normal tissue, and they get caught up in the scan. Now, this scan has been modified to understand brain development by us. So when we look at the brain, we see that there are different parts of the brain which are affected. And you can see here that this is the front of the brain, the back of the brain, and down. You can see the blue part. The blue part here indicates low functioning, and the red and yellow part indicates more functioning. So what did we find here? So this is the brain. We found that the cerebellum, this part here, then the medial temporal region, and the thalamus, which connects two parts of the brain, to right and left brain, are the ones which are functioning less. By and large, the cortex remains to be normal. So these are the three parts which are affected. If you look at the cerebellum, what does the cerebellum do? Coordination, fine motor activity, tone of the body articulation, tongue movement, lip movement, chewing. So you will see a lot of children with autism have these issues. Then the medial temporal, two areas known as hippocampus and amygdala. Hippocampus for learning, understanding, cognition, comprehension, while amygdala is for social interaction and emotional expression. Okay, these are the areas which are affected, and you can understand in autism exactly that is what happens. And thalamus, basically it connects to brain, so bilateral hand activity as well as information processing between two parts of the brain. So this is a research that has been published in the World Journal of Nuclear Medicine, where we have done a baseline study. We have looked at the baseline of and defined what is the extent of the problem in children with autism at different ages. So this is very interesting, and I would take 1 minute of your time to explain to you what this graph says. So when we studied the PET scan of brain of different age groups of children with autism, this is what we found as compared to a normal study, normal brain PET scan, which is the metabolism. So here you can see orange. The blue indicates brain development in a normal child, where we find that this is the early brain, and as the age increases, the brain functioning or brain metabolism increases. Up till 10 years, it increases fast, and after 10, between 10 to 15, it increases, however, slowly. So this is a normal or a typical development. Here you can see in a child with autism, orange indicates brain of a child with autism. You can see earlier the metabolism is high, okay, and with age it is going down. So two things. One, that autism is not static, the brain issue is increasing. Number two, that's why it is important to do any treatment early. Why? Because if you do it early, the gap between an autistic child and a normal child is lesser, and you can push the graph up. But if you wait till late, this is what happens, the gap increases. So results thereby get affected. So Okay, now we have found what is wrong. What are the treatment options? There are a whole lot of treatments which are possible for autism, but it is important to do it in an integrated manner so that they all work together. These are the conventional treatments, and here you can see addition of newer or advanced treatment. But are we doing enough with the conventional treatment? Why do we need additional treatment like stem cell therapy here? Because only rehabilitation and medical intervention may not be enough. It only manages the symptoms, not the actual pathology or the problem in the brain, which I just showed you. But the underlying damage needs to be repaired. None of the above treatments help the brain problem to be repaired. When we studied about 700 patients, we found that in 89% or almost 90% of the patients showed improvement. We'll break it up further. We did a detailed study which was published of patients of 254 patients were studied up to the age of 34 with a average follow-up of 7.5 months. And what did we find? We found that social interaction, this is affected and this is improved. So social interaction improved, eye contact improved, attention concentration improved much, sitting tolerance, command following, communication. So as eye contact improves, attention improves, and socialization improves, the therapist is able to teach the child better, and hence comprehension or understanding improves, whereby now you can train the child to improve in milestones or achieve academic improvements. The various rating scores that is CARS and ISA. ISA is an Indian scale for autism assessment. There also the outcomes show significant improvement. Based on severity, if we look at mild patients versus moderate to severe, we see good improvement, almost 94% improvement in even mild as well as moderate. So even if the child is moderate or severely affected, stem cell treatment can help these children. If you look at age, less than 5 years, so if you get the child early, you have almost 98% success rate. That means out of 100 children who have come to us less than 5 years, at the age of less than 5 years, 98 will show improvement. Okay, if 5 to 10 years, it is about 94 to 95% the success rate. Again, 10 to 15 and 15 and above, slight reduction in the possibility of success. So earlier you intervene, earlier you do the treatment, better are the results. Gender-wise, both in males and females, you see good improvement, equal improvement. If you come early, as soon as the diagnosis is done, results are almost 100%. If you come about in 5 years, results would go down to about 95%. So earlier you come, better the results. Earlier you come after diagnosis, better the results. We did also compared before and after PET scan, and we saw very good results. And let us see a few PET scan before the treatment and 6 months later. So all the blue areas here you can see, the mesial temporal as well as the cerebellum, you can see improvement. The dark blue and blue areas 6 months later have become lesser. So brain is more active. You can see the blue area is almost gone. Blue area is almost gone. So blue indicates less functioning. These cells, blue area doesn't mean that the blue cells have gone. It means the blue cells have become green. So blue has become more active. You can see here blue areas become green. This is over a period of a year and a half. The blue areas is becoming lesser and much lesser. And the dark or red areas, which are hyperactive, are also becoming lesser. So first ever publication that was a proof of concept paper came from India. The first ever publication came from Neurogen, Brain and Spine Institute, which showed that stem cell works in autism. That was from us first. Second came from China. Third came from Italy. Fourth from US. Fifth from US. And then sixth again from India. So these are all our publications, scientific evidence of use of stem cell in autism. As such, there are no major contraindications to combine stem cell. You can combine with rehab, combine with HBOT, you can combine with special diet, supplements, no problem. So let's see a few examples of improvements. This is a child from Kenya, was very, very hyperactive. He was 13 to 14 years old, extremely violent, would run around. You can see very difficult to manage before the treatment. After the treatment, the child over a period of 6 months to a year calmed down. His eye contact improved, his attention improved, he was more trainable, he became more socially active. And also we found that he had not gone to school for 13 years, not even a special school, because he was very violent. But with stem cell we were able to help him go, at least go to a school. He was much more manageable. In 13 years he had not spoken a word. He has now started vocalizing. If you ask him how are you, he will say I am fine. So he started comprehending, understanding, speaking and interaction much better, cycling as well as swimming. So all these things, he is much more trainable now. So this is a child from South Africa who came with severe autism. He had severe head banging, a lot of behavioral issues. You can see he was not complying at all here. After the stem cell, he knows how to hold a spoon. He is much more cooperative. He is cooperating with the therapist. He's learning sign language. A lot of sensory issues. He did not know how to hold a ball and throw a ball. That's severe. With now at home he is doing all that. He now likes water. He likes to, he's now more sensitive. He plays with his animals. He can hold a spoon and eat, which was not possible earlier at all. So you can see that the child is now becoming more trainable because the brain is more responsive. He's learned to you can see request a cookie with sign language. This is a story of a 10-year-old boy from the US. The mother is going to tell the story now.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that. He would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. So research and found out about Neurogen. But the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
The simple procedure.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So improved a jump, a very significant improvement in academics, his language. So he is now like a 15-year-old regular teenager. Normal speech, behavior issues have reduced. He's shifted to a normal school. He gets A grades. So that's the kind of improvement that we have seen even after 10 years of age.
We went to different doctors. We went to different hospitals. And when I brought something, they were like, "Oh no, don't worry, it's because they are boys, they are triplets."
So triplets in a family, just imagine the extent of difficulties.
No child is crying, no child is reading back by. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said that these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autism means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension. Anxiety, of course, as a mother, but I knew they would have.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
So what we find is that with stem cells, the training becomes faster.
Their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, takes a few minutes, and he's asleep.
You see my son's cycle. You try to make them understand what it is to tell them, and they wouldn't. But after stem cell, when we arrived in Kenya, the following day when we went out, and this is cycle.
So coordination, fine motor activity improves, understanding improves, behaviors become much more manageable. You can train these children better.
I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah.
Okay. So I'm going to give you
My
for what?
tomato lollipop. To wear my shoes. That's right.
Ricky is going to the shop and is going to buy a tomato lollipop, whatever that is. You can see that a child with autism, because I've seen them first, very difficult running around, spitting. We had to remove all the stuff from their room because they were so difficult to manage. They would be throwing everything, breaking everything.
You really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works
So it worked for these triplets.
until my children get well.
It will work for it can work for anyone, yeah. So there are multiple examples. Patients from all over the world have come to us. I can go on and on, but I think I should move on to other conditions now. So these were a few examples. I think there was a parent from Rett syndrome was initially part of the autism spectrum, but it's a very severely degenerative condition and hence has been removed. Very rare, occurs only in females. This is a case of a 11-year-old female whom we have published in a scientific journal, and that these children regress after a certain age, and this Rett syndrome is accompanied with seizures. A lot of seizures. There was physical regression, there were contractures in this girl, and neurologically also she was severely affected. With the treatment, there were no side effects. We found that tightness reduced, spasticity reduced, frequency of seizures also reduced, and that's what we have. But we have seen generally that we are able to slow down the deterioration in Rett syndrome, and basically we treat them like any autistic child. But if there are seizures, then it becomes a problem. Intellectual disability is another condition, or it was earlier known as mental retardation, but now the term used as intellectual disability. Ability of an individual, cognition is less, the cognitive development is less, and thereby the individual is unable to perform activity to the right amount to live a fruitful life independently. So you can see in PET scan a lot of blue areas. All these areas are damaged. So generally problem is behaviors are not appropriate. The individual may be very hyperactive. Understanding or cognition is affected. Attention concentration is poor. Communication is affected. We did a study where we found about 84% of the individuals have shown improvement with stem cell therapy, improvement in understanding and cognition, remote memory, problem solving, understanding of relations, social inhibitions became better, and toilet training was achieved. This is the first ever publication which showed stem cell therapy works in intellectual disability. This was published by Neurogen, and this is a scan which shows the damage in the brain which improved after the treatment. You can see the brain is just much more healthier. You can see here the top part is the brain which was affected brain, and you can see that here the brain is like severely affected. It's like somebody has eaten up the brain, and here you can see that the brain is more active, it is more healthy, and healthier brain will perform better. Again, here you can see the green part is improved. So these are various publications on intellectual disability, a few videos. This is a girl who came to us at the age of 26. She was aggressive, she had poor understanding, she was afraid of a lot of things. Her understanding and speech was normal, however, coordination was affected. She was training in a classical Indian dance form, which needs a lot of coordination and rhythm, then that was affected. She is able to now play this instrument. Is a very difficult instrument. She can cook well now. She participated in competitions. So all of these things happened after 26 years, after the patient received stem cell therapy. So the brain has become more active. So this is a 16-year-old boy whom we treated, and his earlier you can see he didn't even know where to put what blocks. Here he is doing it independently, the numbers. He did not have understanding of even at the age of 16 different shapes. So the basic things were lacking in this patient, and now we can see that problem solving has improved. He can do puzzles better. So the brain orients much better after the treatment, starts learning, networking happens better. So this is what we can see, a lot of learning processes. His speech improved, his much more mature. Now he has a small child, a sister, and he is much more, loving towards, knows how to take care. His behavioral issues have become better. His oromotor has improved. That is because of the cerebellum improvement. Fine motor activity has improved. So all these things in normal individual, we take it for granted, but in an affected individual, these are very important part for functional independence. So there are many examples. I'm going to switch to the next. Down syndrome. Down syndrome is another chromosomal abnormality leading to neurodevelopmental problems. We know it as trisomy 21. The 21 number pair chromosome, instead of 2, it is 3. So all others you can see 20 is 2, 19 is, these are chromosome pairs. The 2 instead of 2, 3. So anything more is also not good. So earlier we used to think if there is something less, then there is some problem. But here there is more, and more. So there has to be a balance in our life, in nature. We can see typical features in these, that the vision, the eye formation is different. Epicanthal folds are there. The eyes shape is, the occiput is flat. Ears are small. The hand has only one crease, fingers are curved, especially the small finger, the gap between first and second toe is not appropriate or is more. There is sometimes they have blood disorders, they could have a cardiac, they could have a hole in the heart, and brain development is a problem. Brain doesn't develop appropriately. Cognitive issues, thyroid levels, endocrine issues are all also there. So those other things can be taken care of with medications or surgery. Or brain development can only be assisted by rehabilitation. And now we find that stem cell therapy helps even Down syndrome patients beautifully. So this is a PET. These are different PET scan. You can see here the blue areas here, the even the cerebellum, so tongue movement, lip movement, articulation is affected, fine motor activity is affected. You can see this is a mesial temporal, understanding and learning is again affected. So you can see the blue areas have become green, and there you can see before the treatment, after the treatment, the brain is much more evolved. Let's look at a few videos. Now, this is a girl of 24 years. She's 24 years Down syndrome. She had understanding was very low. Her speech was affected. She could not do any activities independently. With the stem cell treatment, her understanding, fine motor activity improved. Her ability to do daily routine activities improved. She started speaking more clearly. Started training in classical music, and that's amazing, isn't it, for a 24-year-old Down syndrome? She started helping her mother at home to do various activities like cutting vegetables and making juices. So and she's more manageable now. So earlier at age of 24 she was completely dependent. Now she is she knows the numbers as well. So for 24 years she did not learn numbers. Tracing numbers. There's another girl, 12 years old. 12 years she's been going to school for a special school, but where she was not learning anything. She was very difficult to manage, very hyperactive. Motor control was also affected. You can see the gravitation insecurity was there with stem cell therapy. Her problem solving, understanding, speech, clarity, learning numbers, writing, behavior, ability to take care of herself, all grooming, everything has improved because this girl have gone to her home and seen the improvements, so I can vouch for it. You can see that learning, so she's helping the mother at home to clean the vegetables, cut the vegetables. Motor planning. Earlier she needed a lot of support for balance. Learns things faster now. So whatever you teach her now, whatever challenges you throw at her, she's able to grasp it faster. Muscular dystrophy. Muscular dystrophy is a condition where muscles start becoming weak, and the individual or the child, they stop walking. The spine becomes crooked, hand becomes weak. In Duchenne muscular dystrophy, one type of muscular dystrophy, the child may die at the age of about between 15 to 22. So there are different types of muscular dystrophies based on the gene which is affected. In DMD, which is one of the most common as well as one of the most fast progressive muscular dystrophy, there's a mutation in the dystrophin gene, the dystrophin protein is absent, muscle degeneration happens, there are no definitive treatments, there is progressive deterioration, the patient stops walking and becomes having respiratory breathing problem and dies. So there are no treatment as such. That gene therapy is being tried for certain genetic mutations. We can see that this is the MRI of the muscle. This is at the age of 5 years, and slowly the muscle is becoming lesser, and the white part, that is the fiber or fat, is getting accumulated. At the age of, you can see 20 or so, there is hardly any muscle. So it is important that we start any treatment early on, and it has been found, there's a Stanford study which actually says that this is, if you don't treat, this is what happens: the spine gets crooked, the legs become crooked, and the treatment as such, there are very limited options. And what is actually the problem is also that there's a study which shows that DMD is a stem cell disease. That means stem cells are inadequate in Duchenne muscular dystrophy, and by extrapolating, other muscular dystrophies also would have similar problems. So if we do not replenish the stem cells, if we don't give stem cells, no treatment is going to be effective. Because even if you correct the gene defect, if there are no stem cells in the muscles, or the stem cells are not enough, they are not, what will the gene do finally? So what we found that stem cells will help to improve the satellite cells. It reduces the fat infiltration in the muscle, thereby making the muscle stronger. We inject in Neurogen, apart from injecting the cells into the spinal fluid, we also test out each muscle and we inject the cells into the muscle as well, thereby strengthening the bond at the muscle end as well as at the spinal end, and thereby improving the connection between the muscle and the nerve, as well as reducing the muscle weakness or increase in muscle weakness. So what do we see here? That the stem cell helps muscle repair, it replenishes the stem cell pool, it reduces the inflammation, it increases blood supply, it reduces the cell death, and it prevents fibrosis, and thereby, the muscle stretch or elasticity of the muscles is retained better. So we've treated over 1,000 patients and we find almost 85% success rate, and we find improvement in the muscle. These are the different reports, and there is one video of a patient who came from your part of the world, from West Europe, recently to us after 2 times, and this is their experience. Earlier, this was a young child, about 3 years old, and he had difficulty in walking. He's walking much better. He gained strength, he gained more fitness, he can now walk, he can run. Earlier he could hardly run, he would fall down. Though the child is still very early, at least his deterioration has stopped. He can now do bicycle without any auxiliary wheel or support. He can walk uphill, he can climb. So this is a child from your country who has improved, and they did MRI, and also MRI also showed that the progression is very less. Now he can also ride a bicycle. So this is a young child hopefully we will be able to keep his childhood intact for a longer time, and that's our aim. So this is not a definitive cure for muscular dystrophy. All we are trying to do is keep the muscles intact so the muscle degeneration can be slowed down. So I'm skipping the videos now because I want to finish the other conditions. Spinal cord injury, when there is an accident, spine damage at the neck level or at the waist level makes a individual completely paralyzed, and we find about 90 to 96% success rate after stem cell therapy. These are the 2 publications where we have treated thoracolumbar, that is waist down paralyzed as well as neck down paralyzed patients with improvement in ability to sit, stand and walk. We do see improvement in motor. These are all our scientific publications, and let's see a video. How slow and steady improvement with stem cell and good rehab. At least 6 to 8 hours of exercise is important. This patient had difficulty in even turning, is able to roll fast. That happens before and after the treatment. We can now see that kneel walking is improved, trunk control has improved. Earlier he was hardly able to kneel. Hopping has improved. You can see that earlier he needed support, now he is able to hop and walk. That's how slowly there is an improvement. Wheelchair independence improves ability, so trunk control and trunk muscle improve. Slow and steadily we are able to reduce the base of support. Earlier he needed what is known as a Kunmin walker, and then slowly the walker, he was completely wheelchair bound, and now at least with a walker he is able to ambulate. slowly we find that knee locking can be improved. This event is from a small part of India where you can see it like a village like place where he recreated his own rehab setup and did exercise at least 6 to 8 hours every day. You can see that slowly his from parallel bar to walker to now on the slopes. So muscle power from hip down increased, and now with very little support he is able to walk even on the road. So this is below knee splint. Earlier we had an above knee splint, now below knee splint, and knee locking is happening. So that's how his ability to walk is increasing. Brain stroke, again, you know what a brain stroke or paralysis is. These are our publications. So what we find is that with brain stroke, about 90% of the individuals do show improvement, mild improvement in 11%, a significant improvement in 51%. Improvement in walking, hand function, because one side is weak, cognition, understanding, balance, and functional independence is achieved. You can see the brain damage, dark blue here. The whole brain doesn't improve, but you can see the dark blue has become lighter. So here you can see that in the front part the brain activity has improved. These are all our publications. Ataxia is a disorder of the brain where the small brain or the cerebellum starts shrinking and degenerating. There is loss of balance, incoordination, involuntary movement, slurring of speech, and you can see that the small brain is shrinking, and after treatment you can see that the brain functioning has improved. This is a child, a girl who came from the US to us. She underwent stems. When she came to us, she was completely on the wheelchair, that to an automatic wheelchair, severe incoordination. They keep coming back to us every year regularly because this is a degenerative condition. Though it is degenerative, we've been able to find that her condition has stabilized and she has improved in function, though still she has incoordination, but she does swimming independently. She participates in Paralympics. She has won bronze as well as silver medal in the Paralympics, and she is able to work at a place. She is able to ambulate or walk inside the house independently. Her father has given away her wheelchair now that she is able to walk. Head injury after an accident, if there is a damage to the brain, again that beautiful results in head injury. Again, this has been published. 50 patients, study on 50 patients, where we see 50% of the patients showing significant improvement. It's like paralysis, so trunk control improves, speech improves, cognition improves, hand function, walking, so early communication. So earlier, younger the patient, better the results. And this generally head injury is most common in young individuals. So this is the publication, and it shows that if you give multiple doses, the improvement is much better. So if we do a treatment, then after 6 months to 1 year, we repeat the treatment. So it boosts the effect of the first time. Again, you can see the brain, you can see these blue damaged parts of the brain have started to improve. You can see here the damage is starting to improve. This part is completely gone, that will not come back, but overall the brain, you can see, is improved. So what is not there will not improve. This is a young boy, 18-year-old, who fell from a train in Mumbai. So Mumbai trains are known for being very crowded. So people actually hang outside the trains. I'm sure you must have seen some videos. If you look up Mumbai trains, you will see all those videos. So one of the unfortunate incidences where he fell down young, he was 18 years old, had severe brain damage, was in coma for a long time. After he came out of coma, he was extremely aggressive, very resistant. We had to tie his hand to do exercise, otherwise he would start hitting people. So he calmed down, his aggressiveness became lesser, he became much more responsive, hand function improved. He was able to eat and hold a grip. He's able to tell time. He was able to tell his body parts. He was able to count. You can see 1, 2, 3, 4 is counting. He's telling his body parts. His spasticity tightness reduced. His voluntary control improved. He was able to use a mobile better. And earlier you can see he was so difficult and they needed so much support, but slowly he's much more cooperative and needing lesser support and starting to ambulate or walk. Motor neuron disease, a condition which is a degenerative condition. Our aim is to stop deterioration and slow down deterioration. We find that this is a graph of patients who are not treated by stem cell therapy. We see a fast decline in their health, and after treatment, though it is still going down, somewhere it is slowed down and it plateaus. The survival is increased by some months. Now, there are other conditions also that we treat, but I've tried to cover the major conditions. Are there any complications? That's what patients and parents want to know. Are there any complications? So there are no major adverse side effects because we are using the patient's own stem cells. So that is the basic thing. There is no neurological deterioration. We only see sometimes spinal headache, a headache because of the procedure, which becomes all right in 2 to 3 days. Nausea, vomiting, local pain. Those who have a history of fits or seizures or convulsions, or whose EEG is abnormal, there's a 2 to 3% chance of a transient increase in the seizures. For them, we would give a good anti-epileptic cover. So we find that adult stem cell is safe, it is effective for individuals with neurological disorder. The best results, of course, are in children and in neurodevelopmental conditions. Now, this is Neurogen Brain and Spine Institute in Mumbai, city of India. You're all welcome to come and visit us. You will love the care and the family-like treatment that we give. The positivity, we have treated over 10,000 patients from 70 different countries. People from all over the world come to us. This is our infrastructure. This is where we treat our patients. It's very near the local station as well as near a beautiful lake. This is our operation theater, a state of operation theater, along with our stem cell laboratory. This is a laboratory where all the processing happens. This is the stay facility. Comprehensive rehabilitation or neurorehabilitation under one roof and with multidisciplinary teams. So we have a whole team of doctors who will be working on the patients. Rehabilitation helps to improve the outcome of the stem cell therapy as well as improve the brain functioning. It's a teamwork between stem cell therapy and neurorehabilitation. So stem cell is the seed while rehabilitation is the water and the fertilizer. So together they work beautifully. This is our physiotherapy department where the treatments are going on. This is our occupational therapy department. This Autism Child Development Center. This is a specialized center for children with autism and other neurodevelopmental conditions. We have made it child friendly. Children love to go there and play. They don't want to get out of this place. Aquatic therapy. Spinal cord injury walking tract. This is where spinal cord injury, muscular dystrophy, and head injury patients are rehabilitated. They're made to walk like in this long passage so that the brain starts to learn that the body needs to walk. Sensory integration room, part of neurodevelopmental therapy for autism. This is training in ADLs, take care of himself as well as do regular activity, brushing, wearing, grooming, very important for a child to learn. This is speech therapy, special education, play therapy. Plus we do a lot of writing and awareness programs, we write a lot of books for academics, for professionals as well as for parents as well as caretakers. And This is the core team, the main team behind in Neurogen, Dr. Alok Sharma, a neurosurgeon, as well as the vision behind Neurogen Brain and Spine Institute, a visionary. He's the director. Myself, Dr. Nandini. I'm his deputy director as well as head of medical services. My focus or my expertise is stem cell and regenerative medicine. Dr. Jacob, he is almost 80 years old, no, 80 years young individual, a physiotherapist, a very, very senior consultant. Dr. Prerna and Dr. Himangi. Dr. Prerna is again a regenerative medicine expert, as well as Dr. Himangi is a physician, a head of research, as well as she herself is suffering from the neurodegenerative condition that is amyotrophic lateral sclerosis or motor neuron. We are ISO accredited and GLP GMP accredited. This is a award from the European Medical Association from Brussels, Belgium, for best medical practice. This is our national award on Best Institute of Stem Cells. This is again the Rose of Paracelsus award to Neurogen. Best Hospital Award, Inspirational Company Award. So these are different awards. This at the state level given by our ex-chief minister. So healthcare awards showing our credibility. This is can get in touch with us on this through this website as well as on email ID. I would be happy to talk to anybody who's interested on a virtual consultation. Each patient is appointed a coordinator with whom you can be in touch with. The program is of 7 days. Typically treatment, you have to come to us for 7 days, Sunday to Saturday. Sunday would be arrival and some part of assessment, blood workup. Monday would be all the other tests and blood workup. Tuesday is actual day of stem cell procedure. Wednesday to Saturday is a rehabilitation and discharge, where we will give you all the advice what you need to go back and do at home. So what is the future of cellular therapy, and what in addition are we planning to do? So what we do plan is a comprehensive program. Most of these conditions, neurological conditions, are aging processes. So anti-aging processes not only for neurological conditions, but in addition for us as well. As we age, we want to live a better quality life. So what we have in addition, newer treatments will affect other conditions as well. But what I would like to talk about in addition is along with cellular therapy and rehabilitation, integrative therapies to help the neurological condition as well. So this is something which we would initiate during the stay here. Hyperbaric oxygen therapy helps improve oxygenation in the brain as well as helps the stem cells. To improve ozone therapy, again ozone sauna, like a steam bath. Ozone will help it is a versatile gas. It helps the body to fight infection, improve your cellular respiration, well as improve your immunity. Gut cleansing, body cryotherapy, infrared sauna, all these intravenous vitamins, all these help together to improve the outcome, especially in case of dementias and muscular dystrophies and cerebral ataxias and degenerative conditions. This is in addition recent advances which now act along with the stem cell therapy. So now all these together gives us a ray of hope, cellular therapy along with other treatment processes. So this is to conclude, this is a father of our nation. Many of you would have heard about him, Mahatma Gandhi. And when he started the freedom struggle for India, he believed that to believe that what has not occurred in history will not occur at all is to argue disbelief in the dignity of man. So if anybody has said that this is not possible, or your child cannot be treated, or he will never live a full life, never believe. There is always hope. There is a possibility to help children. There is a possibility that treatments are there right in front of you or around the corner, which you aren't aware about. So never give up hope, and something is always possible.
With the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors, and innovators, patients, and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
Again, with this landmark speech by Barack Obama, thank you, all of you, for being still there in the webinar, even though it's almost 2 hours since the start. I would again like to apologize for the delay, for the technical issues that happened. This were unavoidable, and I really appreciate that you're all still there, and I would be happy to answer any questions. This is my email ID. You can reach me directly at any point of time on my email. I would be happy to communicate with you, and I will be taking questions. Please do write questions on the Q&A. You will see there is a chat box. If you put your questions there, I will read out and answer them one by one. If you also want to be directly in touch with me, you can send your questions to me on email as well. Sorry, before I go, I would like to play a testimonial, a patient from Slovenia who came and who is happy to share their experience, so that you know that somebody from your country has come and has been treated by us. So was
video. Video is trying to shoot down.
Thank you so much, and we are waiting to welcome Teeth and his parents. That is tomorrow. I think they are arriving, isn't it? So I would now request Christina to speak again. We'll just give you access to.
Yeah.
Only speak, huh?
Hi.
Hi, Christina. How
Hi.
are you? Was it too long? I'm sorry.
Just a second. I can't see myself.
Yes, we are still give you. Wait a minute. We are giving you a video rights. Just hold on. क्या कर रहा है? देना. Yeah. So just give us half a minute. More than a year. Okay.
She's a host.
I'm really
Yes. Yeah. Now you are a panelist.
okay.
You can enable your video now. तू नहीं कर सकता? You can click on your.
Oh, I see it.
Yeah.
Okay.
Are you able to do that? Click on your video icon.
I can't. Video settings.
Huh? Yeah. Now you see. Now you check. Can you see a video icon?
I see my video icon, but not myself.
No. Click on the video icon. Click on the video icon now. Now, yes.
Oh, yeah. Hello.
Hello. Now we can see the video.
I'm really thank you for a presentation. I'm really glad that we get through that seminar and that we connected. It was really nice presentation. Thank you also to parents.
Okay. Christina's network is, I think, slow to catch up. Christina, I think you should disable your video so that you have a better network and then just use the audio. If you can hear me. I think Christina has got disconnected. Till she comes, I will just take a few questions. I think her network is an issue, so I will, till she comes, let me take a few questions. Lucia from Slovenia has a question about Rett syndrome. Have you treated patients with Rett? And what was the outcome? Rett syndrome is not very common. Off my head, I can remember treating at least 3 to 4 Rett syndrome. The ones who came early to us, we were able to slow down the progression, because one patient who came very late at the age of 11 was completely bedridden by the time she came to us. So those who have come to us at 3 or 4 or 5 years, we are able to stabilize their condition and make them more responsive. But because the challenge in Rett syndrome is that it's a degenerative condition and the brain is shrinking. So if you could communicate with us directly and let us know the condition of the child, we will be able to tell you better what results to expect in that particular condition of your child. What is the role of stem cell in epilepsy? No, stem cell doesn't have a role in epilepsy, in the sense that we sometimes find that seizures or epilepsy may get stimulated. So per se, there is no epilepsy will need to be treated with medications. My child is 9 kilograms. Is he heavy enough to receive cell therapy? Yes, he's heavy enough to receive cell therapy. No problem. He should just not have cough, cold, or chest infection. So if he's is otherwise active child, 9 kilos is fine. Okay, Christina, 2 years and 9 kilos is fine. Please do send us a video of him so that we can evaluate his condition. Alia is asking about Lyme inflammation, neurological. So number one, I would need to know whether it is a confirmed case of Lyme disease. And Lyme is a bacterial condition. Generally, it should be treated with antibiotics. And once the active infection is treated, then we can treat the patient for the neurological issues or neurodeficit. But first, the Lyme needs to be treated, number one. We currently are not using cord blood or cells stored in biobank. So even if that cells are infected, we really don't need it. We will be taking cells from the bone marrow. So the child needs to be treated first. Do send us the reports. Sometimes these are old Lyme diseases which have undergone the treatment, have been the infection has subsided, but the problem in the brain or neurodeficit remains. That can be treated with stem cell treatment taken from the bone marrow. What about using dental stem cells? Dental stem cells, we have not really started using. Dental stem cells have limited, they're still being studied, and they need to be multiplied. So I think Christina is back. Christina, are you back? उसको देना है क्या?
This audio.
Christina, I would suggest use your audio.
Okay.
Yeah, I was I was just answering
the questions.
question.
Yes, nice. Thank you. I am back again, so I'm sorry that this inconvenience I fell out. So
yeah. So you want to continue now?
Yes, I want to continue. It's
Please,
okay.
yeah, please do speak.
So, hvala lepa, da ste se pridružili vsem. Hvala tudi vsemu. Sprašujte, vprašajte, spodaj so pač te boksi, kjer lahko napišete vprašanja in kar vas zanima. Zato, ker dr. Nandini je res strokovnjakinja na tem področju. Angliščino lahko Yes?
Yeah, you're continuing. Yeah, you had become mute. Yeah.
I'm unmute.
So are you done? Do you want to, have you spoken what you need to speak?
Yeah, I did it.
Yeah.
I did it. It's okay.
Okay.
So I just said it that we are really glad that you are here, and that if they have some questions, just write it down. It's no matter if there is in Slovenian language. So I will translate it if there is was a
Okay. So yes, yeah. So. Yes, thank you. So Christina says that I have already sent it to him made last year. He had an operation on spinal cord. He had a cavernoma removed from the spinal cord, and he isn't walking, sitting, crawling, and does not eat any food. He is only breastfeeding. Okay. So do send it to us again. I will review it again. And if you have not got an answer, you will definitely get an answer. Mr. Anonymous attendee seems to be a very faithful attender of a webinar, and you can reach me directly. You can just email me. Can stem cell therapy induce neuroplasticity? Yes, it can. Yes, but stem cell along with rehabilitation. So rehabilitation is the primary modality, and stem cell therapy will assist the rehabilitation to basically induce neuroplasticity. How many therapies children normally receive? It depends on the extent of the problem and depends on the condition. So if it's a severe damage, maybe 2 or 3, and if it's very mild, then 1 should be enough. So, but the time period between 2 procedures is a minimum of 6 months. So we need to wait for 6 months to see the effect of the first, and then between 6 months to 1 year, decide about another treatment. Christina, one of my colleagues, Larissa, will get in touch with you, and will discuss more in detail about the process and costing and everything. I think any more questions? Questions are still coming, I think. Thank you. Most welcome, Christina. Have a great day. If there are any questions that you think of later, you can send your questions to Christina as well, or you can email to us at contact@neurogenbsi.com.
Dr. Nandini, there is one question more about Rett syndrome.
Yeah, right. I answered the Rett syndrome.
Okay.
We have atypical. I'm wondering there's a possibility of inactivating a mutation or screening healthy and unhealthy ones. Do you always have same stem cell origin or possibility of clone cells multiplying? So no. So we the treatment that we do will not correct the genetic mutation. It works on the principle of paracrine effect of stimulating the cells in the brain using hematopoietic stem cells. The cells that we use are blood cells. They are hematopoietic stem cells. So we always have the same source. No cloning process is allowed as at this point for transplantation. Cloning is allowed only for research purpose. So no, we cannot be separating healthy and unhealthy cells. What we will be doing is taking healthy blood cells. We'll be taking healthy bone marrow derived or hematopoietic cells. So if you are saying whether we'll be checking whether these are mutations, no, we will not be checking that. So what we would be working would be on the brain functioning. So our treatment would be based on the PET scan that we do for a particular child. So that would be our baseline.
Ima še kdo kakšno vprašanje, ki bi ga rad vprašal, pa rabi pomoč pri prevodu? Is anyone who have a question and need a translation and help with that? There are Dr. Nandini, there are also questions about the dental stem cells.
Yeah, I answered. So dental stem cells. Yeah,
you answered everything.
Yeah, so dental stem cells currently not being used for treatment of brain conditions. Dental stem cells are mostly being used for problems around more for jaw issues, for orofacial issues. They're still being characterized. So as such for treatment, no, not being used.
What about Lyme disease?
So I told about Lyme disease that in the acute phase we cannot treat. Lyme is a bacterial condition, so it needs to be, the infection needs to be completely removed first. So first that infection needs to be treated as Borrelia recurrentis, this condition. So once the acute infection is treated, then we can treat the neurological condition. We do not need the cord blood cells. We can take the cells from the patient's own bone marrow. So once the body is treated or free of Lyme, whatever deficit or the problem is remaining because of the Lyme can be treated. Will you have future treatment with iPS blood cells which could be repaired? Induced pluripotent stem cell treatment or the research is very specific to a particular type of disorder or condition. What I'm aware of is that for retinal degeneration, this is being done. The research is ongoing and has progressed. For sickle cell anemia, where there is a defect in the formation of red blood cells, research is ongoing. For platelet formation, research is ongoing. In case of Rett syndrome, I am not very sure that IPS will help. And even if it comes, it's going to take a minimum of 5 to 10 years, not lesser than that. So if it's a mosaicism, in fact, mosaicism, that means the condition is mild. That means some cells are normal in the brain and some are affected, right? So I would suggest you share the information with me and we will explore what can be done in this child's condition, Renata. Okay. If stem cell therapy is effective, are results always long-term, or is there a possibility of yet a new decrease in brain activity? Anya, depending on the condition. So if it's generally a stable condition like autism or cerebral palsy, the improvement will be long-term. But if it is a condition which is degenerating, like cerebral atrophy or cerebral ataxia, then there can be a decrease in brain activity because it is the natural progression of the disease. So what condition are we considering here the response or the prognosis will depend on that. Anya, which condition are you concerned with? Is Mr. Ramesh, autism and CP. Anya, autism and CP, whatever improvement is there will remain. Okay, so definitely there won't be any regression. Okay, Mr. Ramesh Rao, I will check with Dr. Arjun. What does this mean? I will find out.
So, any question more? Мате ще късно прашание?
Any more questions?
Yes, I already tried to say that in another way we will finish the webinar.
Yes, I think.
So I'm really glad and really honored, and I'm thank you for your webinar and the time that you are make a nice presentation. Thank you also. I think that there will be more questions. I will send you if there are some questions more. So really thank you, and I wish you a nice day, nice Saturday tomorrow, and Sunday. So thank you very much, Dr. Nandini, and I hope we will see each other again and do some more webinars on particularly thema.
Sure. Thank you so much, Christina, once again for taking all this effort, and it was a pleasure. And yes, hopefully we should see each other virtually and in reality soon. Hope this year, coming year, is better than 2020 in every way possible, and have a happy new year and a great year ahead. Take care, and signing off. Bye.
Thank you. Bye.